The proceeding will start shortly.
Good afternoon, and thank you for your attendance at today's Parliamentary Committee briefing. I'm the Key Advisor to the Minister of Interior Affairs, and I will be discussing what John Ashton has labelled as the silent epidemic, which is COVID-19 within the prison system of England and Wales. As highlighted in the International Journal of Health, complex problems are not solved by universal, untargeted interventions, as these rarely result in significant change for target populations. That is why today's briefing will focus solely on the way in which prisoners have been disproportionately affected by the pandemic. Through the examination of the poor pre-existing conditions of prisons in the UK, which ultimately facilitated the spread of COVID-19, a policy will be proposed that focuses on a paradigm shift in public health policies, as suggested by Paul et al., in order to better prepare for future potential pandemics in the UK. The World Health Organization has declared that COVID-19 is no longer a global health emergency. However, with the death of over 226,000 individuals in the UK from the beginning of the pandemic to 2023, which is the highest excess death rate of any country in the world, it indicates that the UK lacked preparation for the instance of a pandemic. Paul et al. Argue that COVID-19 triggered unprecedented measures worldwide, implying that the UK was not alone in this issue. However, it was due to inept disease control paradigms that caused largely reactionary policies. Had global health policy been prepared and fit for purpose, then it can be suggested that the profoundest public health and economic crisis of our times could have been avoided. Whilst the UK's lack of preparedness had negative effects on all citizens, it can be suggested that prisoners within England and Wales sustained disproportionate negative effects of COVID-19, enabled through British policy decisions. With relation to COVID cases inside the England and Wales prison system, the Office for National Statistics state they do not hold data on the number of COVID-19 cases of prisoners, indicating the lack of care and neglect that the British government have for prisoner life. In relation to deaths in prisons, it was suggested by the HM Prison and Probation Service and Public Health England that they expected over 2,000 prisoner deaths during the pandemic. However, it can be suggested that lockdown measures were efficient, with only 99 prisoner deaths in 2020 in a population of over 86,000 compared to 73,000 deaths in 2020 within the general public. With findings of reduced levels of violence in prison, it can therefore be suggested that there is a silver lining to lockdown policies within the prison system. However, whilst the low death statistics may appear encouraging for British health policy, it is evident that the problems caused by COVID-19 in prison also filtrate into prisoner livelihood and mental health. Allison states that the treatment of UK prisoners during the pandemic meets the UN definition of torture. In support of this, in a recent study, User Voice have found that the effects of COVID-19 on prisoners appear to be long-lasting, with 1 in 3 prisoners showing symptoms of anxiety, which indicate levels of post-traumatic stress. In addition to this, 85% of those surveyed have reported suicidal or self-harm ideation within a 2-week period, which is demonstrated in Figure 1. In order to understand the detrimental effects COVID had on prisoners, please see the expressed opinions of prisoners in Figure 2. So why have prisoners faced disproportionate effects from COVID-19? Well, it is established by scholars such as Bambra et al. That COVID is not a socially neutral disease, meaning the pandemic merely highlighted already existing neglect for marginalised groups. And with Bebbington stating that prisoners are a vulnerable group of society, it can be contended that COVID merely exacerbated the pre-existing issues within the prison system. As a consequence, the current health paradigm of vaccination reliance facilitated health inequalities, as the government had not acknowledged the harm of the imposed restrictions whilst waiting for vaccine rollout. The first pre-existing condition to be discussed that exacerbated the effects of COVID-19 in prison is overcrowding. The HM Inspectorate of Prisons found that even pre-pandemic, prison involved poor conditions such as cramped cells. Figure 3 demonstrates the pore space of a prison cell, in which a space as small as 6.5 metres squared can be shared by 2 people. Reasoning for the lack of space can be attributed to the continuous increase of the UK prison population, as established in Figure 4. And scholars have argued that the UK has its own mass incarceration crisis. The inability to accommodate rules such as social distancing led to additional unfavourable conditions, such as 1 shower a fortnight, losing the ability to exercise, in addition to a 2-hour wait time for the bathroom, leaving prisoners to resort to buckets. From this, it is no question as to why COVID-19 had disproportionate effects on prisoner livelihood and mental health, an aspect which could have been easily avoided had the government been more proactive in their decisions to ensure suitable prison conditions. The second pre-existing condition to be discussed that made prisoners particularly vulnerable to COVID-19 involves the ageing prison population in England and Wales. The local government association found that older individuals are more susceptible to COVID-19 and its effects. Yet despite this, it was found that many countries' response lacked consideration of such populations. This is evident through the examination of the England and Wales prison system, as regardless of the House of Commons finding that older prisoners are the fastest growing group in the prison population, making these prisoners particularly vulnerable, the legislation surrounding COVID-19 left them neglected and forced to continuously share cells without proper sanitation. The third condition to be discussed, which aggravated the effects of COVID-19 in prisons to a disproportionate level, coincides with the overcrowding crisis and involves the high offending rates within prison. Taylor et al. Found adults released from British prisons had a proven reoffending rate of 39%, thereby maintaining the overly high prison population and facilitating the current overcrowding issue of prisons. Additionally, with the BBC suggesting that rehabilitation is dependent on good relationships between prisoners and prison staff, it can be argued that COVID, which involved a lack of the interaction between the two groups, may even worsen rehabilitation rates in the long term, as individuals are released into society without proper care by the prison system, leading to the revolving door syndrome as highlighted in Figure 5. Paul et al. Have continuously stressed that the current strategy of staking everything on a vaccine is insufficient, reactive, short-sighted, and an unnecessary high-stakes wager that is tempting fortune. Therefore, in order to prevent such disproportionate issues and health inequalities from occurring in the instance of a future pandemic, it is necessary to implement new policy. As COVID-19 has been labelled as a crowd disease, indicating it thrives where people congregate, decreasing the prison population must be a governmental priority. Whilst this was an aim of the government during the pandemic, as seen through their early release scheme, its lack of utility implies that the Ministry of Justice had no intention of decreasing the prison population, leaving 80,000 prisoners in what Grierson described as grossly overcrowded, often in sanitary conditions. This is a stark contrast to other countries that prioritise the release of prisoners during the pandemic. As an example, 85,000 prisoners were released in Iran due to the spread of COVID-19. Through implementing a policy which ensures the continuous release of low-risk prisoners, the current problem of overcrowding can be negated alongside future-proofing for further pandemics. The second policy to be discussed involves a paradigm shift. As established throughout this briefing, British and global policy has been reactionary and underprepared, and it is important to recognise that COVID-19 is not the first nor the last pandemic, meaning a holistic approach to global health is necessary. The focus of this approach, with regards to the prison system, would involve bettering prison conditions. Not only would this include improved cell space, fresh air, sanitation, but it would also resolve the overcrowding crisis and allow for better preparedness for future pandemics. As highlighted by Matthewman and Hupatz, outbreaks are inevitable, but pandemics are optional, and shifting to a global health paradigm would allow a better prepared response, for the international handling of disease, which was needed during COVID-19. The final policy to be discussed uses the government's past use of rehabilitation schemes in order to tackle reoffending. Parliament has consistently stated that reoffending rates are too high, with reoffending generating major economic and social costs for the community. Previously, the Transforming Rehabilitation Strategy, known as Through the Gate, sought to provide offenders with continuous mentoring from prisons through to the community. However, the Justice Inspectorates criticised that this scheme was not properly utilised. More recently, the Prison Strategy White Paper sets out to improve rehabilitation, such as through treating addictions, giving education, providing jobs and resettlement passports. While such a strategy is favourable, it is uncertain as to whether the White Paper will be too soon disregarded, as was done with the TSR. With the significance of lowering the prison population in anticipation of a future pandemic, we must allow prisoners to properly reintegrate into society. In order to ensure governmental priority to improving rehabilitation, this policy proposal will involve the setting of a quota to reduce the current reoffending rate to 20% by 2030. Not only will this make society safer, allow for proper rehabilitation, and decrease the public cost of keeping individuals in prisons, but doing so will also increase space in prisons, thereby negating conditions that made prisoners particularly vulnerable during the pandemic. While scholars argue in favour of a mix of policies to better prepare for the instance of a pandemic, since only one policy is an option, I believe Policy 2 is the most suitable, due to its focus on the global health picture paradigm, in addition to providing remedy to an array of issues. Whilst this policy requires governmental funding, which may prove to be difficult considering the 9.7% decrease in GDP in 2020 caused by COVID-19, doing so would also be cost-effective in the long term through preventing the spending of another £410 billion that was used on COVID-19 measures in the instance of another pandemic. To conclude, as expressed by Manning, far too many incarcerated individuals have been sanctioned to unjust punishment due to a lack of emergency preparedness. Therefore, it is clear that we must move towards a global health paradigm, not only to prevent the health inequalities of vulnerable groups during a pandemic, but also to ensure that the UK is better prepared for the next COVID-19. Thank you all for listening today. I know you're all busy, so I tried to keep this as succinct as possible. I hope this briefing was informative and that the policy proposed will be adopted as soon as possible. Thank you all.